Hey everyone, thanks for joining. Let's get started. It's already 7:34 and we have close to 40 people already on the call. It's amazing, you guys. You have showed up on time and we want to deliver on the promise. Start on time, finish on time, get going. Yeah, this is the first webinar which is going to launch actually a list of 5 webinars dubbed Building Impactful Careers in Global Health. I believe everyone who has joined it here is interested in global health in one or the other, or it's already a professional in global health, or you aspire to work in global health. So this webinar of today, we're going to just listen to people who have already launched in the field, who had a training in global health, and already doing some work, so you can learn from their experiences. We have a list of graduates from the University of Global Health Equity who are going to share their experiences. But before we jump right into that, I want to make a little quick introduction about myself and the organizers of this event, this webinar. Starting with me, my name is Eric Nitanga. My background, I'm a medical doctor. And I'm a global health professional as well. I did a master's of global health delivery at the University of Global Health Equity. And currently, I work as a researcher at UGHE, University of Global Health Equity, and also I'm the founder of Aware Health. To go quickly, Aware Health is a health organization. Our mission is to provide knowledge, expertise, and tools to professionals and organizations to augment their impact, particularly health organizations. So, you have an organization, you're a professional, there's work you're doing. So our organization is committed actually to support other organizations. Much of our service revolves around the training and the capacity building. Our training now, the program we have is in communication for leaders, for researchers. We already have that program already, and we work with different organizations to deliver that. 2, we work into content marketing, or it's about communication actually. Organizations want to reach the audience depending on who they work with. So we try to help them actually how they can communicate to them effectively, be it online and physically. So we work with organizations to deliver those messages which help communities improve health. Then lastly, we work with research and innovation. Currently, we have programs on NCDs, non-communicable diseases, but in the future we plan to expand in other fields. So basically, that's what Aware Health is all about. And having this webinar, Building Impactful Careers in Global Health, it's one of the initiatives we have to help young professionals, young leaders actually venture into this amazing field. So in the webinar, there are like 5 of them. If I can just share the calendar with you. Sorry. We have a lineup of 5 webinars that you're going to explore in the next 5 weeks, starting with the one we have today. So the calendar looks something like this. So today we are having a webinar on celebrating global health talents. We're going to learn about UGHE graduates, what global health is, what they have learned, what you're doing, and what you can learn from them. Next week, we focus on global health challenges. Like if you want to develop your work as an organization or as a professional, how do you pick a problem which you can focus on, which is very key. Then the third webinar, we look at actually 4 career pathways you can pick in global health. And following, we look at how do you position yourself in global health to attract opportunities, including using social media and networking. And the last one will be around acing your interview in global health. Much of your work will be doing interviews, so we'll be sharing with you the techniques and strategies and the way you can approach the interview. Basically, this is the schedule. So I don't want to waste more time. I hope this gives you an overview of what Aware Health is and the whole plan we have the next 5 weeks to enrich your experience in learning about global health. So I will welcome my co-host, Mignon Umurerwa, who is a student in global health security, actually, at Yonsei University in South Korea. He's going to be hosting our event today. Mignon, you're welcome. The floor is yours. Where we lead, we follow.
Thank you so much, Eric. Good evening, everyone, and warm welcome to the first webinar of our 5-part series, as Eric mentioned, with the title of Building Impactful Careers in Global Health. Yes, as he mentioned, I'm also a student. I'm doing Masters in Global Health Security at Yonsei University in South Korea. My name is Mignon Omurerwa, and I'll be moderating today's session. And I'm truly grateful to have each and every one of you here. We have 35 attendees till now, which is really amazing. Welcome, everyone. And we're going to begin this series of, discussions with a theme which is both timely and deeply meaningful, celebrating global health talents. You've seen the poster. Today we're hosting recent graduates from University of Global Health Equity. And most of the times we see graduation as a very important milestone, but we also believe that what happens after graduation matters even more, which is why today's session we're going to explore the journey in general, the steps, the decisions, the challenges, and the impacts that follow everything, academic training, graduation, especially within the context of global health. Which is why I'm delighted to welcome our amazing panelists today. And let me introduce them a little bit. I'm just going to mention their names. If they can turn on their cameras to wave to the attendees and the audience, that will be fine. So let's begin with Viviane Marie-France Nionizeye. She is a graduate of the Masters of Global Health Delivery in the track of gender and sexual reproductive health. Viviane, if you can wave to the congregation, turn in your camera.
I don't think you guys can see me. Hi.
Hi, welcome. It's a pleasure to have you here. And we have Nhwari Kenny today. He's also a graduate in Masters in Global Health Delivery, but with a focus on One Health. He's having trouble with his cameras, but I know where he is, he's waving. Welcome, Kenny. We're very glad to have you here today. We have also Dr. Marie-Merci Chuzuzo. She's also a graduate specializing in global surgery.
Hi.
Hi, merci. Thank you for joining us today. We also have Dr. Emmanuel Mugabo. He's also a graduate in health management.
Hello.
Hi, Dr. Emmanuel. Thank you so much for joining us today. And also, last but not least, we also have Dr. Eden Gatesi, who is a graduate of the MBBS and also MGHD programs.
Hello, good evening.
Good evening, Dr. Eden. Thank you so much. Tonight, we have these 5 amazing panelists. And to get us started, let us invite each panelist, like following the order I mentioned, to briefly introduce themselves. Just share briefly what track you did and what were you doing before joining UGHE, what you did immediately after graduation, just a simple highlight of what you do, your background, and then later we're going to dive into the core questions that we have today. But before that, allow me to take you in overall the structure that today's session is going to follow. We began with brief introductions of our panelists. We already had a an overview of what Aware Health, which is hosting these discussions, is, and the purpose and objectives of this seminar. And then we're going to have simple, not a lot of questions to the panelists we have today. And then we open the floor to the audience because your perspectives and curiosity are central to this webinar today. And for the record, for proper flow of the conversation, we're going to drop our questions in the chat box, and then I'll be reading them out loud. If you want to dedicate one particular question to a specific panelist, please mention that. So that's just the flow that we're going to use. Therefore, allow me to get started with knowing our panelists. Let's begin with Viviane.
Okay. Thank you very much. As she mentioned, my name. Can you guys hear me?
Yes.
Or I need to be that loud? Okay. As she mentioned, my name is Viviane Yonizera Marie France. I am a global health professional. But before that, I used to work before I joined UGHE. I used to work as a project manager for an organization called the Managers Initiative, and I was leading a project and also coordinating a center. So the project that I was leading was providing vocational training for young girls and women in all their diversity. We had different groups, and we're providing them with vocational training, and that program was in partnership with Mastercard Foundation. So when I joined UGHE, I was doing Masters in Global Health Delivery, but I was doing Gender and Sexual Reproductive Health and Rights because I am very, very passionate about women empowerment. I love everything that empowers women fighting for their rights. So that is that about me. Apart from that, I am a content creator. I do content around development, fashion. I have a website, I have a YouTube channel, I have a whole Instagram. Like, I can never get bored. Apart from that, I am a very creative person, innovative, and achiever, and I love having fun. So I think you also asked about talking about what we did after graduation, right?
Yes.
Yeah, so I think I'll start my journey after we defended our thesis because we didn't graduate straight away. It took us like 5 months to graduate. So when I went back home, it was an overwhelming feeling because when I joined UGH, I was basically a nurse. I forgot to mention that I have a bachelor in general nursing. And when I got back home, now I was a whole global health professional. So I didn't know what I wanted to do. So most of my journey before graduating was more about identifying what I wanted to do in the global health space, because having a degree is not enough. You need to know what you need to do with that degree. So that's what I was doing mostly, and developed a whole passion of research when I was at UGHE. So most of the projects that I'm working on right now and that I was working on when I finished my whole thesis defense was about research and using feminist research approach. So thank you.
Thank you so much. Oh, that was so insightful. Thank you so much, Viviane. Let's hear from Kenny next. Kenny, you're welcome.
Hello, everyone. So sorry, I have trouble with my camera, so I'll just speak. I think you can hear me.
It's okay.
My name is Mwari Kenny Bivegete. I did the Masters of Global Health Delivery at UGHE, but specifically the track of One Health, or labeled as the best practice. So yeah. Now, before joining UGHE, I worked on mainly as research as a research assistant for some organization working on mental health. I also worked for some organization working on digital health, and also I did some work research in predictive modeling of infectious disease. And yeah, so that mainly I have a background in research, but before that my bachelor's degree was in environmental sciences. Right now I'm working as a lecturer of One Health in the Center for One Health at UGHE. Yeah, thank you.
Thank you so much, Kenny. Allow us to have next Dr. Marie Merci.
Hi, good evening. Can you hear me?
Yes.
All right. So my name is Marie Merci Huzuzo. I'm Rwandese. I suppose maybe there are people who are not Rwandese here. So I'm from Rwanda and I'm a medical doctor. I did my medicine in China and I came here to work. So before I joined UGHE to do my master's in global health delivery, specifically for global surgery, I was working at the hospital. I was working as an intern, and I joined actually UGHE while I was still working. So it was really intense. But later on, after I finished my internship, then I joined full time at UGHE. So after we finished school, yes, after I finished school, as Vivian said, it was really a whole big journey of finding yourself, now wondering what you're gonna do. But the only thing I wanted at the moment was to rest, at least for a short period of time, because the master's is really intense. So we had to rest at least for a short period of time. And later on, I found my way into global health spaces, because me, I'm very much interested in yes, global health, but leadership and health system strengthening. I got a chance to work with the center which I was studying, the Center for Equity in Global Surgery. So it was, at least I was like, okay, since I'm here, it will be, it's a horizon. I'm into the space of actually finding what to do, which is even what I'm doing right now. I'm an academic support consultant. It's at UGHE, still in the global health, in the global surgery, but I'm also working with the center, but with also the MasterCard Foundation. So yeah, that's what I'm doing right now. I'm passionate about surgery, but I'm more passionate about global health, making sure that there's equity in access to care. So yeah, thank you.
Thank you so much, Marie Merci. It was so insightful. And let's now have Dr. Emmanuel. Let's go ahead.
Hello. I'm always happy when I hear what other people have been doing and what they inspire to do. All right. I'm Mugawe Emmanuel Biakagaba. I'm a medical doctor. I graduated in 2023, and then I worked in Ruhengeri. After that, I went to work in a medicalized health center in Kigali, in Remera. So I would say that before joining UGHE full time, I was mostly a researcher helping out with different groups of people. It could be residents or some NGOs, and I would do anything in research. I would help with data collection, analysis, or the full manuscript. I didn't mind so long as they gave me raw data and I read what was in and the findings. Well, we also did some trainings. We trained. So in the medicalized health center, I mainly focused on the antenatal care and family planning. So we were training nurses and midwives to do ultrasounds in health centers. I would say that's part of what I was doing before coming. So my aspirations, I always wanted to do orthopedic surgery. I had already applied and I was admitted to start residency. And then I've always had this debate with some of my colleagues who finished together working in the Ministry of Health and other NGOs, and we've always had this debate about the healthcare system and how it's going. So I had this whole curiosity of trying to understand how it works. So when I got admitted in UGHE, I was like, yeah, it's just 1 year. Let me jump over there, learn everything they know, and then I can come back. I can still join surgery. So yeah, health management was really awesome. Now I want to know more. I think I've switched, not going in surgery anymore. I'm more looking into healthcare systems, health financing, and we're having all these debates. So from UGHE, I did a coordination in a research project, a qualitative study about medical devices. And after this, so this project is about to the end. We are remaining with presentations with the funders and the sponsors and other groups. But from there, I'm applying to join the Ministry of Health. I was hoping I can get some spot in their programs and see more about the health systems. Thanks. I think I.
Well,
Thank you. Thank you so much, Dr. Emmanuel. That was insightful. I feel like I already have a lot of questions. Dear audience, save your questions for we're going to save enough time at the end of the conversation for our panelists. Yeah, let's talk about all those adjustments, transitions of passions and dreams from orthopedic surgery to health management. I don't know. Let's talk about it later, okay? All right, let's have Dr. Eden Gatisi last, and then we dive into questions.
Yes, thank you. As they mentioned, my name is Eden Gatesi. Still getting used to the title doctor, but it's coming. And it's not easy to speak after all these people with experience, because for me, my entire life has been studying. Before coming to UGHE, I was studying, and after graduation, I'm still studying. Yeah, but throughout the medical education, I would say that I was involved in a couple of things. One was mainly like three things: leadership, research, and community service. So I would say for leadership, during my medical school, which I did here at UGHE, I was the student council president, the inaugural one, and where I mainly worked at bridging students and staff, and still new school, new campus, trying to improve our connection between the school and other schools as well as the community. And the next thing that I was involved more in is research, where I co-founded the Research Mentorship and Training Program, which was like an initiative that is bringing together medical students in Rwanda now from URA, AUKA, ASOME, and UGHE to learn together knowledge, skills, and get time to practice research. And I was also I also joined the UGHE Research Society, where we're involved in carrying out different researches as medical students. And third, I would like to talk about like community service, which I was also involved in as a medical student, where mainly we initiated a program called Dirubuntu Initiative, which was which main intention was to help hospitalized patients in Butaro, but also in other hospitals who are not able to financially support themselves. And also another initiative that we had, it was IWEHA, which is Initiative for Women Equity in Health Access, which is also more about empowering women, girls, and advocacy. Yes. And so that's mainly what I did during my medical school. And later on, I did my internship at Ruhengeri. I was almost going to work with Dr. Emmanuel, but he left and came to UGHE then. And I also did part of my internship at Kabgai Level 2 Teaching Hospital as well. And currently now, I am starting a residency in general surgery, again at UGHE, as I said, still studying. But yeah, exploring general surgery as I keep engaging in research. And now I'm starting to think of hospital administration, maybe to do it later. So it's still a long journey to explore. But yeah, that's briefly what I can talk about.
All right.
wow.
Amazing. Thank you so much. Oh, God. Thank you so much for taking us through your personal journey in global health, especially before, during, and after your academic pursuits at University of Global Health Equity. And thank you so much for sharing the bigger picture of what brought you where you are right now in your career. So, to be specific, can each one of you reflect on that transition? We all talked about what we were passionate about before joining UGHE, what the track we joined and how we feel about it at the moment. Can you please share just one defining moment? It could be a decision, a challenge, an opportunity, or even a failure that truly shaped your path in global health and influenced you to be where you are at the moment. Be it skills, technical confidence, networking, navigating into the market today, just one specific defining moment that would like to share to us that shaped your career in global health. Maybe people like us who are still students would like to hear from that so that, who knows, we learn from that. So let's round again from Viviane and then follow the flow. Viviane, you're welcome.
Okay, thank you very much. One of the things that shaped my journey after doing my whole studies and going back to the real world, as I mentioned, is that when you are doing your masters, when you're at school, you feel like when you go out, you're going to change the world. Like that's the idea they are selling you, and it's really good. You really change the world. But I feel like after I finished, I saw that there were so many things that I can do and so many interesting paths that I can follow now that I had my master's and now that I had like some expertise in gender sexual reproductive. So one of the things that helped me was to meet other people that are working in the field that I wanted to join, to learn from them what the market is, the kind of skills that I need to have. And when I was meeting, like I can call them now my mentors, one of the things they emphasized on was having strategic thinking. So they were like, there's so many things you can do, there's so many programs you can join, so many organizations you can join, but you need to sit down and think about where you want to be in 5 years. You need to strategically plan for your career. So that is something that I started to do right away. So I sat down with myself and I was like, what are the professions that I want to work in? Like now, like what are the top most professions that I want? And I found that I love research and project management and advocacy. So after narrowing down to the things that I wanted to do, I started looking for organizations that were doing the things that I was doing. And another thing in the strategic thinking is that now that you know what you want to do, where you want to work, you can just like reach out to them and be like, oh, I want to join your organization. You reach out with a plan because you just like, this is what I want to do and this is what I can do for you. So for example, for me, I love research. So after UGH, I've been reading papers. The old version of me will not comprehend that I'll be reading research papers because in the past I was not that person. So now I've been reading research and then trying to see the gaps, especially research done in Rwanda. For example, recently I saw that teenage pregnancy is increasing in the past 5 years. So for me, I started thinking, what can we do? Where is the gap? So strategic thinking was one of the things that really helped me. And another thing is using a gender equity approach or a feminine approach where I'm like going beyond the numbers. Let's say if the teenage pregnancy is growing, what are the causes? Like what is beyond that number? What are the structural barriers that are contributing to this? What are the social stigma contributing to this? Because that is one of the things that we learned at UGHE. They focused a lot on teaching us about the social determinants of health. So that is something that I have embedded in my mind. So everything that I do now, every program that I'm working on, I try to have that kind of lens to try to see like, can I go beyond the numbers, beyond the paper, beyond the things that I'm seeing in front of me? So I think that is that.
Strategic thinking. Thank you so much, Viviane. And let's have Marie Merci next. And just a gentle reminder to keep all your responses around 2 minutes because as you can see in the chat box, we already have questions coming from the audience. So let's save up more time for listening from the audience, all right? Dr. Merci, you're welcome.
Thank you so much. All right. Okay. So turning point, right? For me, as I said, I was working at the hospital before I joined UGHE. And trust me, when you're working at a health facility, which is not I was working in town, but you still see gaps. So I would sit in a consultation room and patient after patient, you keep seeing these So I would call them bottlenecks, right? You keep seeing that, okay, the patient tells you there's no medication, or you ask for something, you can't find it, and you're like, okay, so I'm at the hospital, I'm supposed to treat patients, but again, I feel like I'm not doing what I'm supposed to do. So I started thinking, okay, so what exactly is holding or limiting me from actually maximizing my capacity as a doctor and as a person who really wants to see something better for my patients. And I loved surgery. I was like, okay, most of surgical care that is given at district hospitals is not really, as I can't say it's bad, but it's also not maximized. There's still gaps. So I was like, okay, so if I can't change anything right now, there's something I can maybe, build myself or build capacity where I can sit somewhere and actually change something. That's where I was like, okay, if I did my master's in global health, because I feel like that's where the policies are made, that's where decisions are made. Maybe if I'm there, I can do something. That's how I used to think when I'm seated. So, and it didn't just happen like that in a blink of an eye. You reach there and they give you all sorts of information, all sorts of knowledge, but I can maybe simplify it into a system thinking. Yes, where you're not looking at a problem from just a program, not a programmatic patient, be like, okay, my patient needs medication, so they should get medication. So for me, that's how I was thinking before. But then I'm now seeing that it's not only about finding medication to my patient, because that is not sustainable. So I started thinking, okay, I have to go deep. I have to dive deeper into how systems are actually built. Then I can be able to actually solve the problem. So I would say the turning point was to actually see the care being given to my patients, but also to actually see solutions that will last, not just something that will solve that patient's problem or this one, but create a system that can actually sustain the people. Yes, if I may say it like that.
True. Thank you so much. Thank you, merci. And let's have Kenny. Kenny, are you there? Welcome.
Yes. Okay. Thank you. So I think Merci and Vivian gave great answers. So for me, the most defining moment. So let me first take you back. For people that were paying attention when I was saying about what I used to.
Excuse me, Kenny, can you try to get close to your device?
Yes, can you hear me now?
Okay, good now.
Perfect.
Go ahead.
So I was saying for people that were paying attention when I was talking about my background before joining UGHE, they would ask me this question: how does digital health, how does predictive modeling connect to One Health, the track I did? So the answer for that, I think, it's not that well connected, but the reason I think now I'm working in One Health and the reason I chose One Health is it's the most defining moment for me, because when doing predictive modeling, working in digital health, trust me, those might be some of the coolest research jobs in health. Working with predictive modeling, making models that can predict how people will have certain infectious disease. But during during UGHE, in our One Health class, we had this thing called field school, where we went on the field for 2 weeks to identify One Health challenges and try to create with the community solutions for those problems. So from there, I saw some cases of podoconiosis. I saw some cases of snake bites in the community, and these are problems that are shaped mainly by how people live, what activities they do. Also some cases of cysto. So for example, people that cultivate in rice, they have no protection. they get more cases of schistosomiasis, and trying to create solutions with these communities, it gave me this sense of fulfillment. I felt like I'm having a direct impact on people's life, trying to help them come up with solutions that can make them free from all these diseases, many diseases such as neglected tropical diseases. So for me, being with the community, working with the community, and having a direct impact on people's lives, that was a defining moment for me. It really touched, like, it's different for making a model that can predict how people will get like acute respiratory infection. It's also nice, but for me, I felt like having that direct impact is more fulfilling for me. So yeah, that was the most defining moment. So that feels cool. So from there, I've been always wanting to go in academia plus the knowledge I have, but also academia is more about also making those researches that impact people's life. So yeah, I think that moment shaped my career in a way that is different to what I had envisioned before. Thank you.
Thank you, Kenny. Thank you. Passion in community engagement. That was his push towards taking one health track in global health delivery. Thank you so much. So talking about passion and what you really want to do, let us have Dr. Emmanuel, and I'll personally request for him to focus on the transition I talked about. I personally feel curious because I know there is someone out here or among our audiences who might be also facing similar shifts. The passion, what you really want to do, especially if you're in middle of two choices at the moment. What was your defining moment and how did you end up in global health delivery? And, share us your journey. Welcome, Dr. Emmanuel.
All right. Thank you very much. Now, I think the ones who spoke before me have said most of, I've answered a lot about the transitioning. So here's the thing. I would just say my medical school took longer than most people. I will not go into details, but let's say it took about 14 years, right? So a lot of questions came in. Should I drop out? Why am I even fighting for this? And I always told this to my family because they were worried at some point. They figured I may be about to drop out. And I always told them this was the best job ever. Like, even if I went back knowing it would take all these years, I think I would still do medicine, right? I love the patients. I love the work. Medicine is so real. It's not like the world out there where people can put on suits and smiles. Medicine is just down to earth. You're meeting people who are suffering from the world. And the general meaning of medicine is having the capacity to cure pain, right? I don't know if you can hear me. It's frozen. Can you hear me?
It's okay. We can hear you now. Go ahead.
All right. So I like that. It's not about ego, but it's also more about knowing yourself. So if I ever feel, at first that was how it started. If I ever feel pain, I wanted to know why I have that pain. What is it exactly? Okay, good. So that's medicine. I was doing clinical practice. There is a very good doctor, a friend of mine. He's a gynecologist. Well, now he's a fellow in family planning and safe abortion. During, I think, back in 2019, he told me he's bored about treating one patient. He was ahead of me. He was bored, and he was like, I feel like I'm not really finding the source of the problem. So he pulled me. He was like, "Let's go do some research courses so that we can start doing research." Okay, that was during our break, 2019, 2020. So New Year's, I was in class somewhere learning about research, and then we started doing research. And we worked with a few organizations. Most of them were in maternal health. Some of them were working with youth who were born with HIV or who got it during birth, but with HIV. And some of them were with surgeries, plastic surgery. So we went in all kinds of research. So by the time I finished, I had this curiosity that had already grown in me. What is it exactly about health systems that is wrong? It just feels like something is wrong. Health, we were supposed to be helping each others, and people were not supposed to suffer this much. But hey, doing clinics was all I wanted because orthopedic surgeons were cool, and I liked it, and I always felt like I'm good with my hands. But when I got admitted, as I said in UJT, I said, let me go check it out. And I would just say simply, Prof. Rex managed to convince me, right? When I was even in class, Eric knows it. We were in the same class. Eric knows. I was still saying, I will go back to clinics. I'm going back to do my surgery, right? I even applied a few times, did some exams. But let's just say that now I'm so I've been talking to different people, talking about these different other methods where they can reach to people, treat them, at least make their lives better. There are a lot of projects out here, and it just opened my eyes to there could be something wrong with the system, and maybe the more we stay and trying to find out what's happening, like the system is growing well. It's performing in Rwanda, we are performing really good, but I think we can do better. There are a lot of specialists, brilliant minds out here focusing on what's still not going well. How do we make it better? And I'm also curious. I want to know what they'll find out. So that's where we are right now, if I can say. Thank you.
Thank you so much, Manuel. Thank you. And let's have Dr. Eden Gatesi.
Yes.
And audience, please keep dropping your questions. The panelists are here for you. Any question, please drop it in the chat box, okay? Eden, please go ahead. Thank you.
Yes, thank you. So I would say that me considering how I did my master's in health management here, and I think that considering doing master's in health management, I used to love really surgery that much. So I wanted to go straight to surgery right after medical school, or at least if I'm going to do an MJHD, then I would go for global surgery. But then there's some similarities with what Dr. Merci talked about, and so she made my life easier. I'm going to be brief. So when we're doing our internship, there's this time that I met a woman who was young, middle-aged, a woman who was just diagnosed with diabetes, and he came to the hospital, her sugars were high, and in that week there was no potassium being done, and for someone we're suspecting like diabetic ketoacidosis, we had to really monitor potassium, but it was not being done in the hospital. And I tried pushing, asking why is potassium not being done. The woman was not able to pay for herself from the private hospital. And so I tried to keep asking the hospital leadership, like, why can't it be done here? What's wrong? What's missing? And, the answers are always around 3 words, like stock out, reagent stock out, a supply chain process, it's delaying, the systems, those are like the words that are being used repeatedly when there's something like that. And yeah, I felt like I'm not doing enough as a doctor. I felt helpless. I feel like despite all the knowledge that I know that I have, that I need to do potassium, that I need to give this medication, then at the end of the day, it's nowhere to be found. So, and I'm not helping. And I feel like I wanted to learn more about those systems that they talk about that makes things not work even despite the knowledge that the doctors have or what's happening. And so that's how I said, like, let me join health management track. And I got to learn about, yes, those words, supply chain systems and stuff. And not just learning it, but also understanding it and learning a better way of strengthening these systems. As Dr. Emmanuel says that, they're doing good, but they can do better in time to come. So that's how I went for health management, and I still have passion for surgery, and I feel like I want to have that skills as well. So I joined general surgery. But as it's like doing all of that at the same time, I'm still thinking about hospital management in the future, so that could be able to combine now all those like not just operate, not just cut people open, but also be able to know after I cut them open, are they able to get all the medications? Are they able to be transferred to wherever they can get better management, and to learn all those how it works and how it can be made better. So yeah.
Thank you, Eden, and everyone else for sharing your journeys. This is amazing. The reflections, or all of them, really highlighted how diverse and non-linear global health career can really be. But if I'm right, you guys talked about motivating or pushing moments, the habits that push you to your professional growth. But I didn't hear any challenge, except only maybe from Emmanuel. He's the one who talked about the harsh part. And I'm pretty sure you might have had one. So let us talk about that in focus of growth and learning along the way. And please promise me that we only have like 8 minutes to go, and we'll go in the chat box. Like, have 1 minute, talk about one single challenge and link it with a piece of advice you would give to a student, an aspiring global health professional, or an upcoming, global health leader, anyone passionate to do what you did. A piece of advice you would wrap up with, link it with one challenge you met throughout your academic journey, and then we go to the chat box. Eden, since you stay here, we'll go with you and then go backwards, all right? 1 minute, 1 minute, 1 minute, and then we go to the chat box for the questions from the audience, all right? Please go ahead.
So I would say, yes, there are so many challenges, but one that I would talk about is you see that there is a problem in the community or in the hospital or in the system, but then you approach the approach of solving that challenge or solving that problem that you have in mind. Sometimes it doesn't really work with the reality. So you think you've got the knowledge and you want to change things, but then some systems are still rigid and it's hard to even penetrate through. And one advice that I would give about that is something that I really learned from this medical journey or academic journey, is to have connections, have people who are already in the systems, who are already in positions to change these problems, get guidance from them, how things work already, and also share insight with them, because these are people who can, who are able to mentor you, to support you, to like show you how things work, and also to try help your dream or your thoughts or your solution that you're bringing turn into a reality. So connections, yes.
Connections. And we heard where you also talked about the part of mentorship, not only getting connected, but also learning from, those big people already place or in the system. So let's go with Kenny. Tell us any challenge and give us a piece of advice we'll wrap up with.
Okay.
Kenny,
Yeah. Can you hear me? Nice.
Yes.
Okay, perfect. For me, what I would say was like a challenge. As I said, I worked in the research industry for quite some time before joining UGHE, and I had already proven myself as I would say a good researcher, where I won this award for in the Rwanda National Health Policy and Research Conference for my abstract. But then joining UGHE, I got introduced to many other aspects of UGHE, many other ways to do research than from what I knew. At first, it was very hard for me to understand what they were teaching and all, because I thought I knew research. I thought I would teach a class about research. But what it showed me, there is a lot we don't know. You might think you know a lot, but still, from anyone can teach you something new. Anyone, be it faculty, they have experiences, they lived what you didn't live. So they have experience on how to do things different from you. It doesn't mean they're wrong, but it means that you should learn a thing or two from them. Another thing I learned mainly from our faculty, you always have to learn, but also criticize something. Not criticize it in a way to reduce its value, but to see if it matched its intent. So mainly in research, when you see results of a research paper, don't just accept it as the Bible without criticizing the methodology they use to reach certain results. So I think that's the most thing I learned, that one, you can learn from someone. Two, it's not wrong to try to criticize something. Thank you.
Thank you. Learning with purpose and positive criticism. All right. Thank you so much, Kenny. Let's now have Dr. Merci. 1 minute, and then we have Dr. Emmanuel next.
All right. Thank you, everyone. I'm also still learning from their experience and the lessons they took. So for me, I would say one of the biggest challenge I faced was, this is like a revelation I got when we were in class, is, there's so much that has to be done. And immediately you feel small. Despite the big, you feel like, okay, I'm doing my master's at a good school where I'm learning important things. But again, you look at the whole global health area, you're like, there's so much that needs to be done. So there's that feeling of, okay, am I really capable of doing something? You start feeling small. But there's this saying we usually have, I think it's Dean who introduced it. I mean, the first time I heard it, he said that if you're not invited to the table, bring your own chair. So I took that. I was like, okay, yes, there's so much that has to be done. The system is huge and so many small parts that needs to be addressed. But what can I do? What's the smallest thing that I can do right now? I may not change everything, but today there's something I can do. Is it a paper that I have to write? Is it an opinion piece that I have to write? Is it a networking, someone that I need to reach out to? I mean, in that sense of what can I do? And then start doing that. Because system, it takes long to change and it takes a long time to have the impact that you want to see. So be patient, but also don't just be patient where you're seated. Do something, even if as small as it can be. Yes, a drop, it might be a drop today, but tomorrow it will be a bucket of water. Another day it will be something else. So yes.
Thank you. Thank you so much, Merci. Let's have Dr. Manuel.
I only have 1 minute. Well, what I can say is that most of the things were said already. Medicine is huge. The knowledge out there is too much. The work is too much. So the biggest challenge that I at least had was that There's so much to be done, so much to learn, and it's overwhelming, under pressure. You don't want to be sued for malpractice, but at the same time, it's not. So there's a lot of dilemma and ethical challenges in medicine. But you're doing the right thing. I would say it's really good. Whoever is working in the health field, that's it. You're doing the right thing. Even if it's overwhelming, it's really good. In the end, there's full satisfaction. My advice there would just be research, research, research. Right? So, knowledge will open your vision. You may have a vision right now that is clouded, and the more you read, the more you attack instead of fearing the knowledge that comes with the healthcare system and medicine and the diseases. Instead of worrying about it, you tackle it, face it. It opens your eyes to a lot of things, and don't worry, you will find out what you want to do. You'll find out your calling, your passion, everything starts becoming clear with knowledge. Just don't fight it. Do research, read, talk to people, all of them, from the cleaners to everyone in the group, and you'll eventually fit in. It becomes easier with time. Thank you.
Great. Thank you. Research, explore yourself, and at the end of the day, you will fit in. Thank you. Let's have Vivian. And then, real quick, we go to the chat section as we wrap up, okay?
Thank you very much. I think most of them, my colleagues touched on them. But one of the challenges that I faced when I joined UGHE was multitasking. So I am known to be an achiever, but I love to have like a to-do list, to do one task and then finish it, take another task. At UGHE, you cannot do that. We would have like 5 assignments to submit before 11:59. You have like 5 assignments, you have your practicum projects you're working on, and I used to work some of the times. So I had so many things that required my attention. So one of the things that I learned from UGHE is that I can multitask. I used to have like 10 windows open, and I'll tackle everything on those windows, and then I'll finish by 11:59. So that is one of the challenges that I faced when I started, because I was so overwhelmed. I was not used to that kind of workload. But now I have reached a point where nothing scares me right now. Give me a deadline. I love deadlines. I'm not scared. I can do anything. So an advice that I can give is that you can achieve anything you put your mind into. Most of the time we limit ourselves because we think, oh my God, I cannot do this. That is too much. You can achieve anything. If something is on your plate, you can do it. I did it, so can you. Thank you.
Thank you so much, Vivian, for ending this discussion on a very positive note. We all can definitely do anything we put all our minds on. And if they did it, we can definitely do that. Thank you so much. I think we have 2 people, Terry and Emmanuel, who dropped their questions in the chat box, if I'm right. So Terry said, hello, my name is Terry from Kenya. Hello, Terry. He's a student undertaking the bachelor's in community health, passionate in global health. I am currently in search for an NGO to partake my attachment, if any leads or connection of how to get any help, please help. Also feel free to help in research. Thank you so much for your commitment, Terry. And yeah, we have Dr. Eric here, the founder of Where Health. He explained much about what Where Health does, and community engagement is also part of it. I would advise that you can stay connected, keep attending these seminars, unless Dr. Eric wants to add something on Terry's commitment, then I can go ahead with Emmanuel's question. Eric, do you wanna?
Yeah, we can connect via LinkedIn, or he can reach. Then we can. I will send him a direct message so we can connect and discuss how we can provide support. Because as I don't know, Eden mentioned this. So global is about network. You talk to someone and it changes the course of your life. So
true. Thank you so much. And Hello everyone, I'm Emmanuel Nitanga, a medical student at University of Rwanda. I would like to ask Merci, so this is dedicated to Dr. Merci. There is any point you reached and felt that you can quit while you were doing your medical studies in China? This is a question. If so, what did you do to continue moving? Dr. Merci, as brief as you can, because we have the next question, and then that's it. Welcome, Merci.
Thank you. Thank you, Emmanuel, for that question. That was very bold to ask. And I would say when I was doing my medical school in China, was there a point? Okay, so there was no point really, as in I feel like quitting, but then there's the point where you feel like it's a lot and you feel like you can't handle it. So one of the things that I did, or one of the things that helped me to go through those points in life, was having people, having people that you can actually reach out to. So there's that, having, reaching out to people, having that boldness to reach out to people when you're going through that. And I'd also say that invest in your mind. Okay, so for me, this is what I like to do. If I feel like I'm not really, everything is blocked, as you're saying that you feel like low and you want to quit, there's always that thing that clicks and reminds you why you've started or where you're going, right? Is it a book that you have to read that will remind you your capacity, your, that thing that's, kick in your mind and help you actually to gain that momentum. So as something very small, reach out to people and also invest in your growth as a mental growth. Thank you.
Thank you so much, Merci and Emmanuel. And please, if you guys can visit Wear Health profile on LinkedIn, we have all our panelists tagged on their profiles, so you can feel free to reach out directly to them for more guidance. And I hope it's okay with them as well, okay? So here we have Stephen Kugimana. He is a DDS student at University of Rwanda and co-founder of Rwanda Dental Medical Society, working to improve oral health in Rwanda. My question to the panel is, from your experience in global health equity and health management, what practical strategies can help us better integrate oral health into primary healthcare systems in Africa, especially in Rwanda? Also, if we enter a health system that is not open to innovation, what practical steps can we take to still create a positive change? Wow. And if you know any organizations we can collaborate with, please give us a hand. Thank you, seniors. Such a good question, and he didn't dedicate a question specifically to someone, but I think we can handle this to people who did health management track. Is it okay? Because particularly asked about integrating oral health in primary healthcare system. So any panelists from that track or any other, this is open to anyone who can answer this. Please go ahead. Because, okay, the questions are still coming, which is good.
Yes, I will probably say a few words on this. So from our learning experience from medical school, we learned, I would take an example from the eye health and how it was incorporated into the primary health care systems in Rwanda. And so one thing that I learned was Professor Chico, who is the head of the Rio. Yes, the Rio school. So she did ophthalmology from Kenya and stuff, and she was thinking of a way of incorporating this ophthalmology care, eye care, to a primary healthcare system. And so he developed this concept, not make sure that it was very easy for a nurse who works at the health center to understand and to be able to detect like critical things or critical eye conditions that needs to be transferred on time, and also to be able to manage common eye conditions that they're on the level of managing too. So I think practically speaking, having a concept note that's it's not on a level of a dental surgeon, but on a level of a nurse at health center that they're able to understand. And then you're finding connections from the Ministry of Health, reaching out, and probably if Dr. Emmanuel gets there, he will help with that. And yes, I think with that, trying to simplify it for the nurse who is at the health center, like keeping in mind that, and also reaching out for further guidance.
Thank you, Dr. Eden. Did you have any point to be explained by Dr. Emmanuel or any other panelist that wants to say something on this question from Stephen? Because he was asking specifically for oral health. He's a dental surgery student at UR. But I think Eden talked about it. If there is no more supplementation from the panelists, we can read this last question and then wrap up because the time is not on our side. So this is Emmanuel.
Can I just add something?
Yes,
Maybe?
go ahead. Yes,
But
sure.
I have a feeling, yeah. Eden already said it. So for integration of dental health in primary healthcare, just like all other programs, when we're trying to decentralize it, you have to understand that the decentralization process takes care to people who did not get that specific training. So first of all, you don't assume that they don't know. You do a quick research, find out what's going on. And then primary healthcare is usually about preventive. So dental hygiene and everything. You just have to find proof that there is a problem, and then you propose your solution, you draft it up, and then you find there are a lot of NGOs. There are always NGOs out there working on it. You draft it out, you propose it, even MOH can take it, and if they like it and then they enjoy it, then they start implementing it, and that's how it gets integrated. I know that it's already integrated somewhere. You can find other research in other places where they integrated oral health into primary health care and try to repeat the same thing. But it will go with evidence. You first have to find out if people really don't have dental hygiene or something. Yes.
Mm-hmm. Thank you so much, Dr.
Thank
Emmanuel. Thank you. Oh, wow. More questions are still coming, and we're obviously slightly running over time, but I'll read and let's try to be as brief as we can because we still have 4 more sessions coming up. So this is Emmanuel. Yes. Hello, everyone. Thank you for a very nice session. Thank you too. I have a question about how someone is positioned with him or herself in global health beyond studying at UGHE, if he or she doesn't get a chance.
Well, Miguel, I think we should really be very careful to keep the things going. And this is the beginning. So if we delay, people will not come back. We wanna. Sure. But this question on the positioning, we're gonna work on that. We have 4 sessions about positioning global health. You don't go to UGHE to practice global health. There are more options. We explore the pathways. So I would ask them to stay tuned for the coming sessions.
Sure. Emmanuel's question and Abdulaziz Adam questions. I promise you I'm going to save your questions, and please stay alerted and attend the next questions, and we will definitely talk about your questions next time. All right? So thank you so much, guys. I'll hand the closing note to Dr. Eric to give us a closing script, and then Thank you so much for today.
Yeah, Mickey, thank you so much. This was really, really nice. Very natural, very honest, and insightful. Thank you, colleagues. Much of them are my classmates. We had a really good experience together, but the more you shared, I got also to reflect and learn. One quick thing is that if you want to improve health, there are so many moving pieces that should come together to make it work. It's like a car. Tires alone don't move a car. You need the fuel, you need a driver. So there are so many things that come together. So in the next webinars, we explore further actually in this whole space of global health. Yeah, I want to close with one word. Emma said that knowledge broadens your vision. The more you know, the more you dream actually. So it's always one idea that changes your life, your career, and you don't know which idea is that. So I encourage people to keep gathering as many ideas as you can, and one day you bump onto that very aha, eureka moment idea that changed your life. So thank you so much. For people who missed, we'll be sending a recording of this webinar, hopefully tomorrow evening, and we send the link for the next upcoming webinars. So stay tuned. Thank you so much, everyone, for joining. Thank you, Mignone, for leading this. And our panelists, Emma, Viviane, Merci, Eden, and Kenny, thank you for sharing, making time. And our audience, thank you for listening to us and contributing. We look forward to see you next time.
Thank you.
Thank
You're
you.
welcome.
Bye-bye. See you next Tuesday.
Bye.
Bye.
Thank you so much.